Thank you so much for purchasing our Medifuge CGF Concentrated Growth Factor Centrifuge. The purpose of this video is to get you started with the machine and understand its components, especially those related to creating membranes and plasma mixed with bone graft. The Medifuge and all its supplies are laid out on the table, organized by each step of the process. Let's begin with the machine itself. It's a simple device with just two buttons. There's actually one more button on the back that allows you to turn the machine on and off, as well as open and close the lid. For safety reasons, there is no separate open-close button. This button handles both power and lid operation. The purple button is for starting and stopping the centrifugation. It's straightforward. Press it once to start the spinning, and if you need to interrupt the process at any point, just push it again. Let me show you how it works. Press the button once and it will start spinning. If you listen closely, the sound will change, as the machine is uniquely designed to offer multi-speed centrifugation process. This will allow you to collect approximately 1.7 times more growth factors than conventional PRP or PRF. If you ever need to stop the spinning, just press the same button again. Notice the machine will gradually slow down, and once the spinning is completely finished, the lid will automatically open. Never try to force the lid open. Every time you turn on the power, you'll see that the device always displays CGF first, which refers to concentrated growth factors. If you press the mode button, it switches to PRP, or platelet-rich plasma. While PRP is still used for certain orthopedic procedures, in dentistry and general implantology, you will rarely need it. Just set it to CGF for the best results. Let me walk you through the different components. Included inside the Medifuge package are the red and white tubes. The white tube is for liquid growth factors. The growth factors layer formations are the same, but the red tube produces a gummy-like membrane, while the white tube gives you liquid plasma that can be mixed with bone graft material for your procedures. Other components in the package include a box of 3 cc syringes and needles for extracting plasma from the white tubes, a box of 25 tourniquets, a box of 50 21 gauge butterfly needles, along with a rubber cap on the opposite side. Never remove the rubber cap from the needle. It is essential to prevent blood from spilling. Additional items not included in the package are Band-Aids and alcohol prep pads, which must be purchased separately for disinfecting the blood collection area. You'll also need a pair of scissors to cut off the unnecessary RBC layer of the CGF membrane, and a cotton pliers to grab and handle the membrane by itself. You'll need to prepare some 2x2 gauze for the blood collection process. After the blood is drawn, it's important to cover and apply pressure to the area with gauze for a couple minutes to avoid potential bruising. You may want to have a separate container ready to mix the collected plasma with bone graft material. Alternatively, if you purchase the original sticky bone container, it has a section just for making sticky bone, and you can use that. Next, let's go over the blood collection process. Begin by placing a tourniquet on the patient's arm about 1 to 1.5 inches above the blood collection site. Make sure to use an alcohol prep pad to disinfect the area. If the patient's veins are difficult to locate, especially in female patients, they may be deeper under the skin, so you may need to penetrate a little bit deeper with the needle. We also carry a product called Vein Light, which may help you in locating veins. First, make sure the blood collection needle and tube are properly and tightly attached. Once you've found a vein, carefully insert the needle at a 45-degree angle. If you successfully insert the needle, you will see a small red spot at the back of the needle handle. If you don't see it, this means the needle hasn't entered the vein yet, or to try again and gently move the needle inside the vein. Once successful, insert the tube fully into the tube holder, and the needle inside the holder will puncture the tube, causing blood to flow into the tube. Note that the tube is a vacuum on the inside. Once the blood is collected, remove the tourniquet first, then the needle. Lastly, apply a Band-Aid and be sure to keep the patient hydrated before blood collection, as dehydration can significantly affect the speed of the blood flow. Gently mix the blood with the activator in the red tube, but avoid shaking it too vigorously. Swirl it to mix it gently. Once the blood is collected, you'll place the tubes inside the centrifuge machine. It's important to counterbalance the tubes to ensure an even number of tubes inside the machine. If you have an odd number of tubes, you can add a tube with water in it to balance out the load. The Medifuge can hold up to 8 tubes. Now, you can press the purple button to start the centrifugation. This process takes about 12 minutes and 45 seconds. When the centrifuge is finished, you will see 3 layers in the red tube: a clear liquid on top, the CGF membrane just below it, and the red blood cell or RBC layer at the bottom, making a total of 3 layers. In the white tube, you will see 2 layers, the PRP layer and the RBC layer. Let's quickly move on to the process of mixing the plasma with the bone graft material. Always remember to do this first. The PRP plasma in the white tube coagulates quickly, so it must be mixed with the bone immediately after centrifugation. The membrane in the red tube can be left out for hours without issue, so you have more time to work with it. Take the plasma from the white tube and gently extract the liquid using a syringe. The area with the highest concentration of growth factors and CD34+ stem cells is the interface between the PRP and RBC layers. Extract around 1.5 cc of this area using the 3 cc syringe included in the package and mix it with the bone graft. If you want to speed up the setting process, you can use a little bit of plasma, the top layer, from the red tube. The plasma will form on the top layer of the red tube and help the sticky bone set faster. Once the bone graft material is mixed, it will take about 5 to 10 minutes to reach a putty-like consistency. Now, let's look at the final membrane product. Open the red tube and pour the CGF membrane into the provided container. The membrane will appear solid and thick, and it can be used as a substitute for collagen membranes. This membrane will provide healing properties to the graft and help speed up bone remodeling for your patient. Use the scissors to carefully cut off the RBC layer at the end of the membrane. Be sure not to cut it all the way off. Leave a small part attached as it contains CD34+ stem cells and high growth factors. To compress the membrane, place the compression lid on top. You can either press down by hand or let the weight of the lid do its job. I recommend just using the lid's weight for the right amount of pressure. After a few minutes, the membrane will be ready for surgery. Regarding the internal cleaning and maintenance of the machine, there's a metal screw in the center of the rotor. Turn it counterclockwise to remove the rotor and clean it with cavity wipes or mild alcohol. The tube holders can also be removed for cleaning. Here's a quick tip. Always use the gauze or a piece of paper to wipe off the top of the caps after drawing blood. This will save you time on cleaning and prevent the machine from getting dirty quickly. Please keep in mind that the metal screw in the center of the rotor may loosen over time with prolonged use, so make sure to tighten it clockwise from time to time. If it is loose during operation, an E5 error code will appear on the display and the machine will not function properly. A very unique feature of the Medifuge is the UV sterilization function. If you press and hold both the power and the mode button for a few seconds, the machine will activate an ultraviolet light to sterilize all of its internal components. This feature is especially useful in hospital settings and oral surgeons' offices, ensuring that the machine is as clean and as sterile as possible for each use. That concludes the basic Medifuge training. If you have any further questions, please reach out to your representative or contact us at info at usdentalinc.com. US Dental is partnered with the World Academy of Dental Education, WADE, to offer CGF, PRF-related CE courses 2 to 3 times per year. You can find more information about these courses at wadedental.org, or feel free to ask your rep about the course schedule. Thank you all for watching.